We are going to focus on the thalamus and its connections in this video. And their connections. So firstly, we are going to ask some questions. So the first question is, talk about the dorsomedial nuclei. So talk about the dorsomedial nuclei. So this will be the first question. And the next question will be, question 2 will be the talk about the ventral posterolateral nuclei. The third question will be talk about the ventral anterior nuclei. So these questions, the answers will be told in the video, and in the end there is also a bonus question. So to get started, firstly we'll deal with the anterior. So the anterior nuclei, the input is that we are going to look at each category and look at the input, first input, then we'll also look at the output, and after input and output we also will focus on the function. So this is how the strategy is going to be. So first looking at the input. So under the input there is the mammillothalamic tract. So input is nothing but the mammillothalamic tract. So mammillothalamic tract is nothing but the cingulate gyrus as well as the hypothalamus. So this was the input. Then we move on to the output. So under the output we have the cingulate. There is the cingulate gyrus as well as the hypothalamus. So what is the function of this anterior thalamus, the nuclei? So the function is that it regulates regulates the alertness and as well as the attention, and it helps in the acquisition of memory. So it helps in the acquisition of the memory. So then we will move on to the next one, that is the dorsomedial nuclei. What is the dorsomedial? So what is the dorsomedial nuclei? So the dorsomedial, the input, if you look at the input, it is prefrontal cortex. It is the prefrontal. It is nothing but the prefrontal cortex. Then there is also the hypothalamus and also the other thalamic nuclei. So what is the output of this dorsomedial? So the output is that it includes, there is the prefrontal cortex as well as there is presence of the hypothalamus and other thalamic nuclei. Now we will look at the functions of this dorsomedial nucleus. So the function is that there is integration of the somatic. There's integration of the somatic, the visceral, as well as the olfactory information, and it is relation to the emotional feeling. It is related to the emotional feeling and the subjective states. Then we will look at the next one, that is the lateral dorsal, the lateral dorsal, the lateral posterior and the pulvinar. So here the input from the lateral dorsal, lateral posterior and pulvinar is nothing but the cerebral cortex and the thalamic nuclei. Cerebral cortex and the thalamic nuclei. So what is the output? The output here is again the cerebral. It is the cerebral cortex as well as the other thalamic nuclei. The other thalamic nuclei. So what is the function of this lateral dorsal, lateral posterior pulvinar? The function, it still remains unknown. Then we will look at the VP lateral. So it is nothing but VP lateral is nothing but the ventral posterolateral. So what is the ventroposterolateral? So in ventroposterolateral we have the input as well as the output. So looking at the input, the ventroposterolateral, it is the medial lemniscus. This is the input as well as the spinothalamic pathway. So these are the inputs of the ventroposterolateral. And what is the output? So the output here is nothing but the primary somatosensory area, the primary sensory area of the cortex. So what is the function of this? The function is that it relays function is that it relays common sensations, relays common sensations to the consciousness. Next we have the ventral posteromedial. So ventral posteromedial. So what is this ventral posteromedial? And here the output, the firstly we look at the input. So input is nothing but the gustatory is the input, and next input is from the trigeminal. So what is the output of the ventroposteromedial? The output is nothing but the primary somatosensory area, and this is of the cortex. So even in the previous case we saw the primary sensory area, cortex, and this is for the ventroposterolateral as well. So what is the function? The function is also very similar. So the function, it relays. So what does it relay? It relays some common sensations. So it relays the common sensations as well as to the consciousness. Next we move on to the ventro-anterior. The ventral anterior. So the ventral anterior. So under the ventral anterior, the input is that it is there is reticular formation. That is reticular formation, and there is substantia nigra. There is corpus striatum. There is also the premotor cortex, as well as the other thalamic nuclei. So this is the input of the ventral anterior, and then we look at the output. So when we look at the output, this includes the reticular. It includes the reticular formation, and there is also the substantia nigra. So reticular formation, substantia nigra. Then there is also the corpus. So the corpus striatum. and there is also the premotor cortex and the other thalamic nuclei. The other thalamic nuclei. So now the question arises, what is the function of the ventral anterior? So the function is that, now we look at the function of the ventral anterior. The function is that the ventral anterior, it influences the activity, and this is of the motor cortex. Influences the activity of the motor cortex. Next we look at the ventral lateral. So we just saw ventral anterior, now we are looking at the ventral lateral. The ventral lateral. So the ventral lateral is the input, if you see, it is from the cerebellum. It is from the cerebellum and the reticular formation. Next, it is also from the substantia nigra. Then it is also from the corpus striatum and the premotor cortex, as well as the other thalamic nuclei. So this is nothing but the input. Now we look at the output as well. So what is the output of the ventrolateral? So ventrolateral output, it includes the cerebellum. There is also the reticular. There is a reticular formation. There is this reticular formation. There is a substantia nigra as well. There is also the substantia nigra. And post this, there is also the CS. So CS is nothing but the short of the corpus striatum. And there is also the premotor cortex. And it also includes the other thalamic nuclei. So then what we are focusing on is the function. So in case of the ventrolateral, the function is that it influences the activity of the motor cortex. And post this, we will look at the intralaminar. So what is the intralaminar? So interlaminar, we are looking at the input and output. So interlaminar, the input is nothing but it is the reticular. So this reticular formation, and this is the spinothalamic, and the trigeminothalamic tracts. These are the input. Now we'll focus on the output. So what is the output of the interlaminar? The output is to the cerebral cortex. So it is to the cerebral cortex, and this is via. So it is through the thalamic nuclei, and the corpus striatum. So it is to the thalamic nuclei and the corpus striatum. Now we will look at the function of this. So the function is that the intralaminar, the function, it influences the level of consciousness, as well as the alertness. Then we move on to the midline. What is midline? So under the midline, the input is that it can form the reticular formation, and After this, there is the output and the function, it remains unknown. Then we look at the reticular. What is reticular? So the reticular, the input, it comes from cerebral, the cerebral cortex, and as well as the reticular formation. And what about the output? The output, if you see, it comes from the other thalamic nuclei. Now, what is the function of this reticular? So the function of this reticular is that the cerebral cortex, the cerebellar cortex regulating thalamus, and it is regulates the thalamus, regulating the thalamus. Next we have the MGB. So MGB is nothing but the medial geniculate body. So the medial geniculate body, looking at the input, it is the inferior colliculus, then also the lateral lemniscus, inferior colliculus, lateral lemniscus. This is from the predominantly opposite ear. So it is predominantly opposite ear. So what is the output of this? So output, it includes the auditory radiation. So it includes the auditory radiation to the superior temporal gyrus. Now we look at the function. The function of this medial geniculate body is nothing but hearing. So medial geniculate body is associated with hearing. Then we look at the LGB, that is nothing but the lateral geniculate body. So what is this LGB? So lateral geniculate body, first we need to know the input of this and then the output. So what is the input? The input is nothing but there is the optic tract. And what is the output of this? The output is nothing but there is optic radiation. There is optic radiation, and this is to the visual cortex. This is to the visual cortex of the occipital. Visual cortex to the occipital lobe. So what is the function of this lateral geniculate body? So the function is that it helps in the processing the visual information. So the visual information is from the opposite field of vision, from the opposite field of vision. So now we will move on to answering our questions. So we are going to look at the answers. So the first question we asked was, what is the dorsomedial? What is the dorsomedial nuclei? So first we need to know the input. The input is that it is from the prefrontal cortex. Next, it is also from the hypothalamus and the other thalamic nuclei. Then we focus on the output of the dorsomedial. This is the prefrontal cortex. It's a similar one. Prefrontal cortex, the hypothalamus, as well as the other thalamic nuclei. So what is the function of this DM? So what is the function of dorsomedial? So there is integration. It does integration of the somatic. So there is integration of somatic and the visceral and also the olfactory information. So there is integration of the somatic, as well as visceral, and the olfactory info, that is information. And then it is also related, it is related to the emotional feelings and subjective states. To the emotional feelings, also to the subjective states, the subjective states. Then we move on to the next question we asked was, what is the ventroposterolateral? What is the VPL? That is the ventroposterolateral. So the VPL, the firstly looking at the input. So what is the input of the VPL? The input of VPL is nothing but it is the medial lemniscus. And it is also, there is also the spinothalamic pathway. The spinothalamic pathway. And what is the output? The output is by the primary somatosensory area. So primary somatosensory area cortex. So what does this VP do? So the ventroposterolateral, what it does is that it relays. There is relay. It relay the common sensations. So the common sensation, it deals with the common sensations to the consciousness. So this is the ventroposterolateral. So we had asked another question. The other question was, what is the ventroanterior? VA for the ventroanterior. So what is this ventroanterior? So now again the ventroanterior, it has the input and the output, and we're going to look at the functions. So ventroanterior, the input is from the reticular. Input is nothing but the reticular formation. This is the input. Then there is the SN, that is a substantia. It is a substantia nigra. And post this, there is also the corpus striatum. And there is a premotor. There is premotor cortex as well as the other thalamic nuclei. Now we look at the output. The output of the ventral anterior. The output includes the reticular formation and also the substantia nigra. Next, it also includes the corpus striatum. Then it also includes the premotor cortex as well as the other thalamic nuclei. So basically it is the same. And now looking at the function. The function is that it influences. So this ventral anterior, it influences. There is influence. It influences what? It influences the activity. It influences the activity of the motor cortex. So it influences the activity of the motor cortex. So now we are going to look at the bonus questions. So the bonus questions, these can be answered in the comments. So the bonus question, the first question we would like to ask is, talk about anterior nuclei. What happens here? The second question is, what is the input, output and the function of the lateral, dorsal as well as the lateral, posterior and the pulvinar? This is question 2. Next we move on to question 3. So the question 3 is what is the ventral posteromedial? What is the ventral posteromedial? We want to know the input, we want to know the output as well as the function of the ventral posteromedial. These can be answered in the comments.